If this has been happening to you, your weight dropping without any real change in diet or exercise, please watch this video to the end. You may have brushed it off, told yourself it is stress, or even felt quietly pleased about it. But unexplained weight loss is one of medicine's most serious warning signals, and understanding what it means could save your life. Let us start with the clinical definition, because precision matters here. Medically significant unintentional weight loss is defined as losing 5% or more of your baseline body weight within a 6 to 12 month period, without intentional dietary restriction, exercise, or any obvious explanation. For a person weighing 70 kilograms, that is 3.5 kilograms. For someone at 80 kilograms, it is 4 kilograms. If that level of loss has occurred without a clear reason, a medical evaluation is not optional, it is necessary. Losing 10% or more within 6 months is considered an even more urgent finding, strongly associated with serious underlying disease. How often does unexplained weight loss turn out to be cancer? Studies examining patients who presented to doctors with unintentional weight loss as their primary complaint found that between 5 and 37% were ultimately diagnosed with cancer. Among men aged 60 to 69 with measured weight loss of 5% or more, the probability of receiving a cancer diagnosis within 1 year reached approximately 3.4%. When all causes are considered together, more than half of patients with clinically significant unexplained weight loss eventually turn out to have a serious underlying condition. That means what feels like nothing, a few kilograms gone without effort, is statistically far more likely to mean something important than not. Why does cancer cause weight loss? The mechanism is one of the most critical things to understand. Cancer cells are not simply growing silently in one corner of your body. As they multiply, they release large quantities of inflammatory signaling molecules called cytokines, particularly TNF-alpha, interleukin-6, and interleukin-1. These substances travel through the bloodstream and act directly on the hypothalamus, the brain region that regulates hunger, suppressing appetite at the neurological level. Simultaneously, they elevate the body's resting metabolic rate, causing the body to burn through muscle and fat even during rest. The result is a state where no amount of eating can maintain body weight. Medicine calls this cancer cachexia, and it is present at the time of diagnosis in over 34% of cancer patients. Perhaps most sobering is this: approximately 1/3 of all cancer deaths are attributed not to the tumor itself, but to cachexia, the progressive physical deterioration driven by this weight loss spiral. Which cancers are most associated with weight loss? The differences between cancer types are significant. Pancreatic cancer leads the list. Over 80% of pancreatic cancer patients have already experienced weight loss by the time of diagnosis. The pancreas sits deep in the abdomen, producing no early warning symptoms in most cases. By the time weight loss, jaundice, or back pain appears, the disease is often advanced. The 5-year survival rate for pancreatic cancer sits around 14% overall, but drops dramatically in late-stage disease. One critical warning sign specific to pancreatic cancer is new-onset diabetes, with simultaneous unexplained weight loss. In someone with no prior history of blood sugar problems, pancreatic cancer frequently disrupts insulin production, generating diabetes as an early signal. Lung cancer causes weight loss in roughly 60% of patients. When weight loss is accompanied by a persistent cough, blood in sputum, or shortness of breath, the need for imaging is urgent. Lung cancer detected at an early, localized stage has a dramatically better prognosis than disease found after symptoms become obvious. Gastrointestinal cancers, stomach, esophageal, and colorectal, cause weight loss through a direct mechanism. They physically obstruct or interfere with food intake and nutrient absorption. Stomach cancer often begins with indigestion and upper abdominal discomfort, with gradual weight loss following. Colorectal cancer may accompany changes in bowel habits and blood in the stool. These cancers have excellent cure rates when caught early, but outcomes worsen sharply once weight loss begins to show. Lymphoma has a distinctive weight loss profile. Medicine recognizes what are called B symptoms in lymphoma. 3 findings that together constitute a major red flag. These are unintentional loss of more than 10% of body weight within 6 months, unexplained fever above 38 degrees Celsius, and drenching night sweats severe enough to soak through clothing. When 2 or more of these occur together, lymphoma evaluation is essential. Lymphoma is among the most treatment-responsive cancers when caught at the right stage. Liver cancer and bile duct cancer often present with weight loss alongside jaundice, a yellowing of the skin and the whites of the eyes. Anyone with chronic hepatitis B or C, or established cirrhosis, who develops unexplained weight loss should not delay evaluation. Now, a critically important clarification. Unexplained weight loss does not automatically mean cancer. Cancer accounts for roughly 16 to 36% of cases, which means the majority of cases have other explanations. The most common alternative causes deserve equal attention. Hyperthyroidism and overactive thyroid gland accelerates metabolism dramatically, causing weight loss even with normal or increased food intake. It is typically accompanied by a racing heartbeat, heat sensitivity, anxiety, and tremor. This is the most common explanation in younger patients with unexplained weight loss. Type 1 or newly developing type 2 diabetes also causes weight loss. When insulin dysfunction forces the body to burn fat and muscle as fuel, with thirst, frequent urination, and fatigue as accompanying signs. Severe depression significantly suppresses appetite and can produce substantial unintentional weight loss. This is underrecognized and often overlooked. Chronic infections including tuberculosis and HIV cause progressive weight loss over months. Malabsorption conditions such as celiac disease or Crohn's disease prevent proper nutrient absorption and led to persistent weight loss, even with adequate food intake. Here are the specific situations that require prompt medical attention. See a doctor if you have lost 5% or more of your body weight over 6 to 12 months without a clear reason. Act more urgently if weight loss is accompanied by unexplained fever, drenching night sweats, or visible lymph node enlargement. Seek same-day or emergency care if weight loss is accompanied by jaundice, yellowing of the skin or eyes. Get evaluated immediately if weight loss accompanies blood in stool, urine, or sputum. If you are over 60, a long-term smoker, a carrier of hepatitis B or C, or have a strong family history of cancer, apply a lower threshold. Do not wait for the 5% mark. What happens when you go to the doctor? A standard workup for unexplained weight loss typically begins with blood tests. Complete blood count, liver and kidney function, thyroid hormones, blood glucose, and inflammatory markers including CRP and ESR. Depending on findings, abdominal ultrasound, CT scanning of the chest and abdomen, and endoscopy may follow. If initial tests are normal but weight continues to drop, repeat evaluation and additional specialized testing are appropriate. The reason all of this matters so urgently comes down to one number. Survival rates differ enormously based on timing. Most cancers diagnosed at stage 1 or 2 carry 5-year survival rates of 80 to 95%. The same cancers found at stage 3 or 4 often drop below 20 to 40%. Pancreatic cancer found at a late stage sits near 10%. Every month that passes while weight loss is dismissed as harmless is a month in which a stage 1 cancer can become a stage 2, or a stage 2 can become a stage 3. That difference is measured not in statistics but in years of life. If something about this video has stayed with you, if there is a number in your head that you have been dismissing, today is the day to make an appointment. A blood test and an ultrasound can clear your mind completely. If nothing is wrong, or find something at the earliest and most treatable moment if something is. Either outcome is worth knowing. If you found this video valuable, please subscribe and share it, especially with someone who has mentioned recent weight loss without explanation. Next week we are covering the blood test markers that quietly signal cancer risk before obvious symptoms ever appear. Take care of yourself. This video is for informational purposes only and does not replace professional medical diagnosis or treatment. If you are experiencing unexplained weight loss or any of the symptoms described, please consult a qualified healthcare professional promptly.